Well, let's now get you news from the United States. And Moderna, Pfizer, and now Johnson and Johnson will deliver enough doses to fully vaccinate 130 million people. That's more than 1/3 of the U.S. population by the end of March. That's what the pharmaceutical companies have told a House Subcommittee last week. But there is also a word of caution as the vaccine drive moves forward. The director of the U.S. Centers for Disease Control and Prevention has warned that the U.S. is at risk of losing all its recent gains in the battle against COVID as highly contagious variants take advantage of Americans getting lax with safety measures. So she's saying remain on guard and don't get lax about those safety measures and COVID protocols. Well, to talk more about the situation in the U.S., we're joined by Dr. Ishita Dwivedi, Assistant Professor of Medicine, Lenox Hill Hospital, Northwell. Thank you so much, Dr. Dwivedi, for joining us on the show again. So first and foremost, how does the J&J, the Johnson & Johnson vaccine authorization affect the vaccine drive in the U.S.?
Thank you for having me on the show, and hello from New York. This is exciting news for all of us that a third vaccine has now been approved by the FDA for use in the United States. And this comes at a critical time when we are trying to upgrade the vaccination drive and trying to fight the pandemic by increasing the percentage of population that's vaccinated and trying to get past the pandemic as well.
Now, the CDC director has given quite a grim warning about the recent decline in cases and said that, they may be stalled as variants spread. How big a threat are the variants in the United States?
Yes, it's good news that the hospitalizations as well as the new cases every day have seen a decline. It looks like we're past the peak of the pandemic numbers that we saw late in 2020 and especially November, December, and January 2021. You are right that we do worry about the new variants from South Africa as well as the United Kingdom, but it remains to be seen whether how effective the vaccinations that we have currently so far with Pfizer and Moderna are against these variants. So we do remain cautious, and we still maintain that everybody should still wear masks and practice social distancing as much as possible, even if they're vaccinated or awaiting vaccinations. And we should not take this tapering of numbers as a measure to relax on the precautions that we have been taking and we know that are very effective.
Now, some experts have even said that perhaps it's change in behavior of the American population recently that's caused this tapering off of infections rather than the vaccination drive. What is your view of that?
Yes, largely it is the change in the behavior, including wearing masks, mandating masks now by the federal government on all federal sites, as well as we're past the holiday season, so people are not traveling as much and there's less socialization compared to the holiday season in December. Currently, only 15% of the U.S. population has received a single dose of the vaccination, and only 7.7% has received both the doses of vaccination. So it's hard to say that vaccinations are the driving factor, but over a period of time, we do think that that will provide herd immunity and also help to decrease the number of hospitalizations, death, and the total number of cases.
Now, if we talk about, vaccinating the whole world, the good news is Colombia received its first supply under COVAX. And do you think rich countries like the United States and UK should contribute more to this need across the world right now?
I think it has to be a balancing act where we have to obviously protect the population in the United States, as well as the vulnerable population worldwide. So I think it's going to be a matter of prioritizing the vulnerable population, whether it's in the U.S. or the countries abroad, but also making sure that we reach the vulnerable populations within our country, as well as the rural populations within our country, which may have limited access to vaccinations as well.